and we focus on complexity, leadership, and decision-making. This research and this degree is supported by our world-leading research, including in planetary health, which is the focus of today's session. The goal of the Exeter MPH is to prepare leaders in public health that will open new possibilities for healthy publics. We're very pleased to have had a very successful first cohort that is currently in the program, and we look forward to seeing applications and interest from anyone who's interested in advancing population health. So as I said, the goal of today's event is to launch this new Exeter MPH and to celebrate its successful beginning. I'm really pleased to welcome two of our distinguished colleagues to this lecture today. We'll be in conversation about the field of planetary health. We have Professor Sir Andy Haines, who is Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine. Thanks for joining us. And Sir Andy will be in conversation with Professor Lora Fleming, who's Professor of Oceans Epidemiology and Human Health and Director of the European Center for the Environment and Human Health here at the University of Exeter. So thank you both for joining us. Just a little bit of housekeeping. Professor Sir Andy Haines and Professor Lora Fleming will be in conversation for about 40 minutes, after which point we'll be happy to take questions. Please type your questions in the chat box and I'll pick them up and read them out to our fantastic speakers. So without further ado, thanks very much, and I'll hand it over.
Hello, everybody. I'm Lora Fleming, and first I want to thank the organizers of this launch, particularly Professor G.J. Melendez-Torres, Cecilia Menoso-Neblon, and Steph Skates. I really appreciate this, and I feel honored to be part of this launch. I'm particularly interested because this is an area of interest to me, planetary health. And before I introduce our conversation with Professor Sir Andy Haines, who I'm going to refer to as Andy since I've worked with him now for over a decade. It's been a privilege and a pleasure. I just wanted to give a little bit of context to the whole issue of planetary health, climate, and other environmental change from my point of view as a physician epidemiologist who's worked on both sides of the Atlantic as well as other parts around the world for the past 3 to 4 decades. During that time, I've had the privilege of working with many environmental scientists as well as public health and medical people. And what has struck me over these past couple of decades has actually been the lack of presence of public health and medical people at this discussion. And I think there have been rare exceptions to that. And those exceptions have included Tony McMichaels, Paul Epstein, and Andy Haines. They were people who identified and were sort of canaries in the coal mine about the issue of climate and environmental change and its impact on human health and well-being in the medical and public health communities. Until very recently, this was not considered an important discussion point. And so it really is a pleasure and a privilege to be able to now talk with Andy a little bit about his role in making that history happen. And also hopefully to set up our new MPH alumni, graduates, current students, future leaders of public health to take on this role going forward. So Andy, if you can unmute, and we will start our conversation. So, and thank you again for doing this. I really appreciate it.
Pleasure.
So my first question is, what has been your role in public health and medical understanding of the impacts and importance of climate and other environmental change in relation to human health and well-being?
Well, Laura, first of all, thanks for inviting me, and thanks to the organizers for putting on this event. And congratulations also on organizing the MPH, which is really important, important contribution to public health in the West Country and more widely. So my interest in this area started about 30 years ago when I started to hear about this phenomenon of climate change. And I realized that it must have implications for human health because we know that climate and weather are important determinants of health. And indeed, ever since the time of Hippocrates, you know, airs, waters, places, more than 2,500 years ago, it's very clear that the environment has major influences on human health, although that's often forgotten in the medical. So when I heard about this phenomenon, I started to conjecture, if you like, that there would be implications for human health. And I remember I wrote a commentary in the BMJ, actually. I think it's about just about the 30th anniversary of that, actually. So, and where I proposed that if nothing was done, climate change could potentially have catastrophic effects on human health. Well, I didn't get much of a reaction, actually, anyone really, except that I got an email from this guy, Tony McMichael, who you've already mentioned.
Mm.
Tony was really an outstanding leader, an outstanding thinker, actually. Mm. Now, he was a professor of epidemiology and did a lot of work in environmental epidemiology, conventional epidemiology around lead, for example, very important work. And he was also starting to think about this issue of climate change and health around about the same time. So he and I kept in communication. We started writing together about this issue of climate change and health, trying to explore the direct effects, the indirect effects of climate change and health. There was no research money at all at that time. So inevitably, well, a lot of what we wrote was more kind of conceptual, more think pieces and commentaries and so on, making the case for a research agenda, which I have to say wasn't acted on very much, at least initially. It took some time to be accepted. And then Paul Epstein also came on the scene, as you know, the late Paul Epstein, so a great innovative person and a tremendous advocate for climate change mitigation, for environmental health more generally. And Tony and Paul, between them, actually coordinated a series of articles in The Lancet in 1993, which is really groundbreaking, where those articles actually tried to elucidate the pathways by which climate change would impact on human health. So that was really quite a wake-up call. The WHO was early on the game as well, and a number of us were involved in a WHO publication as early as 1996, and then the IPCC, the Intergovernmental Panel on Climate Change. So I came into this through climate change and health, but it was in 2014 that Richard Horton wrote a commentary from Public to Planetary Health with a number of colleagues. And he made the case that there were multiple environmental drivers that were impacting on human health. And we needed to take those into account if we were to sustain public health. And he then approached me to chair the Lancet Commission on Planetary Health, which was funded by the Rockefeller Foundation. The current director of the then director of the foundation was very much making it her kind of signature, if you like, as it was the end of her time at the foundation. So within a very short time, about 9 months, we wrote this commission report on planetary health and trying to really enumerate the links between these multiple environmental changes in human health. And we found very useful the whole framing of planetary boundaries. That had been developed by Stefan and Rockstrom and others, where they showed that there were a number, I mean, the most recent iteration was 9 planetary boundaries within which humanity could flourish. Historically, in the Holocene epoch, which was that 11,500 years in which humanity grew from being hunter-gatherers to agriculturalists to largely urban livers, then we had flourished to a reasonable degree, inequitably, of course, but there had been genuine progress. But the danger was that would be undermined by all these environmental changes that were taking place, which has led to people calling us our current epoch the Anthropocene, term by Paul Crutzen, as you know, in 2000. So we outlined those challenges, and we started to also develop some, at least point some fingers, some pathways to potential solutions, both to adaptation and mitigation. So that, in a nutshell, was how I got involved. And I started off with, being an academic family doctor with a background also in epidemiology, and then have transitioned to being someone concerned about the environment. And I must say I had some misgivings about the term planetary health when I first heard it, because my concern was that people would think, well, it's nothing to do with me. It's all happening at the planetary level. Nothing I can do about it. And that's just not true, of course. And there are really powerful connections between local, even our personal behaviors, and certainly local activities, and what's happening on the global scale. So we tried to disabuse people of the fact that just because it was planetary health, it didn't mean to say that you couldn't have an impact in your personal and professional life.
I've been really impressed with how quickly it is grabbed, particularly, again, the medical and public health communities. I do think that a lot of environmental scientists are still circling around it because they seem to be very much in love with a more ecosystem service or One Health approach. But I think planetary health has really caught also the more popular imagination, which sort of leads me to a question of how can we actualize planetary health at the level of public health or even in medical practice?
Yeah, well, thanks. I mean, first of all, it is important to be clear about what the concept that we had of planetary health. And of course, some ecologists would, when they think of planetary health, they think about healthy ecosystems. And that, of course, is absolutely vital.
Mm-hmm.
The way we conceptualized it was the health of human civilizations and then the state of natural systems on which underpin the health of our civilization. So it was an integrated concept which integrated the health of humanity,
Mm-hmm.
the health of the natural systems. And that's a little bit of a struggle for some people because some people still refer to the health of the planet separately from the health of people. And our view was it was a systems issue. It's all related. You can't divorce one from the other. So in terms of how we integrate that from the public health, with the public health perspective, that's a really vital question. And, you know, conventional public health really just focuses on improving human health without asking the bigger question, well, what is the impact of humanity on the environment?
Mm-hmm.
Is there a potential for us to undermine our own health through the combined activities of the human population, now well over 7.5 billion people on a small planet? And of course, left unchecked, our behaviors, our activities are eroding those natural systems on which our health ultimately depends.
Mm-hmm.
And so what's really crucial in the field of public health is, first of all, to recognize that our planet has finite boundaries, that we have to live within those. At some point, we may, of course, be able to leave the surface of the planet and create civilizations elsewhere, but we're a long way from doing that. And we have to really ensure that we can flourish on the planet where we are. So what is important, I think, is to develop strategies which integrate public health with safeguarding the natural systems on which that health depends. And there are two broad types of strategies. So there's adaptation.
Mm-hmm.
We've got to adapt to the change that we can't prevent because it's already happening. You know, we're already at 1 degree, over 1 degree global mean temperature increase from pre-industrial. We've already damaged biodiversity irreversibly. You know, we're losing species at least fold greater than pre-human times, probably much more than that. You know, we have depleted fresh water. The fresh water supplies that were laid down over millennia in parts of the world, these are dramatically depleted. And if you look at the Arab world, they've, you know, depleted their freshwater supplies per capita by about 75% over recent decades. So that's completely unsustainable. So there's a lot that's already happened, and we'll have to adapt to that. And in adapting to it, we need to try to tackle the other big issue, which is equity.
Yeah.
And in my career, I was fortunate to work with someone who many of you will have heard of, called Julian Tudor Hart. Now, Julian Tudor Hart was a very, very interesting, sadly, he died last year. He was a great thinker. And it's also the 50th anniversary of his publication, The Inverse Care Law. The Lancet's just written to me to remind me of that, actually. And his publication, The Inverse Care Law, was also extremely powerful and a seminal idea. It was set very much framed within the UK of the early 1970s, late 1960s, but the lesson or the points are timeless because we're still suffering from the inverse care law. The people that most need effective healthcare are least likely to get it. And of course, also the social determinants of health in many societies are still unaddressed. Mm-hmm. How should we reinterpret Julian Tudor Hart's issue or vision of addressing the inverse care law in the Anthropocene epoch? Well, I would argue that in order to do that, we need to put inequities very much at the heart of strategies for planetary health, because it is those populations often the least, in a sense, responsible, or at least having contributed least to environmental footprints that are likely to suffer and are suffering the greatest from the impacts of climate and other environmental changes. So in adapting to and in mitigating environmental change, we need to have equity very much center stage, not just resilient health systems, but also reducing the environmental footprint of our society, but doing so in a way which protects health, promotes health, and also enhances equity as far as is possible. So I think that's the challenge, to integrate addressing the social and environmental determinants of health, the quest for universal health coverage, affordable, effective healthcare, which of course is the other part of the sort of triangle, if you like, which can help to sustain our health in the Anthropocene. But finally, I think we have to have a positive vision, because at the moment we're all, there is a lot of despair around. People are suffering not just the direct effects of COVID, but also the indirect effects as well. And it's very important to have a vision of the kind of society in which we want to live. I think one of the messages of our Planetary Health Commission was that we need to be putting human health and the environment much more centrally in the economy. Currently, the political discourse is largely around economic growth. So GDP has become a kind of fetish. It's become the metric by which the success of our society is judged. But it's just a means to an end. If it's helpful, let's use it. But if it's not, then let's not be dominated by it. So we need to be putting human health within these planetary boundaries, actually at the center of the political discourse. And I think that is a role, for public health to bring that to stage, to political discourse, not in a necessarily party political way, but in a way which challenges political thinkers to reframe their ideas in the context of the Anthropocene.
Completely agree. Before I go on to another question, I did have one thing. You and I have talked a lot about the importance of big data in this whole discussion and in monitoring, and also linking environmental and health communities together to do the work going forward. And I wondered if you could briefly touch on your own work around the Planetary Observatory.
Yeah, thanks, Laura. I mean, for some time we've been concerned that we're flying a little bit blind. So we know that exposures have been changing. The Lancet countdown reminds us every year that emissions are going up, exposures are increasing, but we still don't really know what impact that's having exactly on the ground, because many of the communities that are most vulnerable, we don't have good data for. Even high-income countries, we often don't monitor the effects of environmental change over a long-term time course. So what we've been saying, and we've been talking about this for some time, is the importance of linking environmental data with human health data. So lots of environmental data around. Organizations like the World Resources Institute, for example, they have a fantastic portal, Resource Watch, which is 200 open access databases. You can just find it on the internet very quickly, but it doesn't say very much about human health, thing actually. And so we've been talking to them and to yourselves and others to say, how can we start to link some of these potential sources of data? And there are some real opportunities. So obviously sensing, and some of my other colleagues at the London School, Rochelle Schneider dos Santos and Antonio Gasparini have been working on downscaling some remote sensing data down to 1 kilometer squared level UK, where you can start to link air pollution, climate data to human health in the UK, but that may become increasingly possible as well internationally. So we think that there's a lot of potential for remote sensing, and for, of course, low-cost sensors, as we know, are also becoming more and more widely available. So they are transforming the prospect for us. But we mustn't neglect bottom-up data collection. So there are also potential, I think, to link a lot of the cohort studies funded by the Wellcome Trust and others, and some of these demographic surveillance sites in places like Sub-Saharan Africa and Asia, the In-Depth Network, for example, which monitors migration, deaths, births in a range of really quite vulnerable populations, amounting to over 3 million people. What we need to do is to link those kind of resources to climate and other environmental data. And that's the vision that we're trying to develop, and we're trying to persuade funders to put a modest amount of resources into this. And it's very interesting that funders often don't want to do that because first of all, they see it as something rather mundane, exciting, but they fail to grasp that unless you actually do this, you can't answer the really exciting research questions. The second is they're concerned about an open-ended budgetary commitment because monitoring needs to go on and needs to be refined. And that I can understand, but it's really a small amount of money compared with the kind of resources that we have. We spend billions and billions and billions on biomedical research every year. And of course, you know, all of us benefit to some extent from that, but it's become imbalanced. So we spend virtually nothing on planetary health research, and we spend a disproportionate amount on molecular biomedicine, which is important. And I'm not decrying that at all. But I'm saying that what we need is balance.
I agree. And I also think there's a whole piece there around interdisciplinary training. It struck me that having worked with environmental scientists for years, that their modeling techniques, we would benefit in the public health community from learning from them and how they handle big data and stuff.
Absolutely.
Okay, my next question, which does go off of some of the other things you've been talking about, but something that I think is very pertinent now. How can we better open public health and particularly planetary health and truly involve diverse communities, including people of color?
Yeah, this is really crucial. And of course, by diverse communities, we mean diverse in terms of social origins, in terms of ethnicity, in terms of geography, and in terms of discipline as well.
Yeah.
I think one of the exciting things about planetary health is for the first time, we're really experiencing what transdisciplinary work is like. And it involves respecting many different knowledge systems, if I can call them that, because it means that we need to work with people from a whole range of different perspectives, you know, from anthropologists to mathematical modelers, climatologists, and so on, economists. And I think that's really, really exciting. And it means we're all learning all the time. We're learning from each other. And it also means that the learning is not at all one way. I mean, levels of seniority, you know, we're all learning. So that's exciting. And I think it also opens the way for new voices as well. And one of the important are the voices of indigenous communities, because indigenous communities have for long been the custodians in the sense of nature. And if you look at many of the most biodiverse parts of the world, they're actually inhabited by indigenous people whose cultures, whose spiritual beliefs actually emphasize the kind of oneness of humanity and nature. And I think we can learn a lot from those belief systems and in integrating science more with some of those indigenous perspectives. So that's, I think, a really important insight that we need to build on. And I think we're now beginning to learn how to listen to our colleagues, friends from indigenous communities, and to understand their perspective, and also to appreciate their really important role in custodians of nature. It isn't just a matter of Western conservation organizations coming in and telling people how to conserve nature. Many of these communities have been doing it for thousands of years because their whole livelihood depends on living in balance with nature. So there's a great deal of traditional knowledge that we can learn from and have mutual respect. So I think it is increasingly a diverse community. We're seeing a lot of young people coming into it. I think it's easier in many ways for young researchers to understand this field. They immediately grasp the importance of systems thinking. They take to this whole just transdisciplinary perspective probably more easily than some of the those who are more embedded in kind of traditional monodisciplinary silos. Many of us were brought up in those silos, but I mean, personally, I had a great advantage of being a family doctor or a GP, so and I didn't pretend to be a specialist in anything, but what I did do was to really rapidly acquire new knowledge when I needed it. And I think that skill of generalism is underrated.
I agree.
And generalists, you know, we need to be able to acquire new knowledge quickly, to be critical about it, to understand, you know, to be skeptical, but not negative. Positive skepticism is good. And I think this is a great opportunity. Also, I think we've seen, because of Fridays for the Future and youth movements in general, they have helped to mobilize public opinion a lot around these issues. And I think they quite rightly pointed out that
I need to kill this. I'm on another call.
have failed in a sense to sustain, the planet and have failed to support planetary health. And so that's a fair comment, and we have to listen to that.
Yeah, and I think that particularly in inter-transdisciplinary work, which also includes the communities that are affected by these things,
Absolutely.
people who are generalists are necessary, but you also need the specialists, right?
You need both. You need both to work together.
Totally. All right, 2 more questions. How can we as individuals live according to the tenets of planetary health? You're somebody that I have admired a long time because you actually try to walk the talk. So I wondered if you could share a little bit of what you try to do in your own life, as well as other things you think we could all try to do.
Well, I don't know. I mean, I sort of feel that we're, in a sense, we're all hypocrites in a way, because we've all benefited from the high carbon economy, and I as much as anyone else,
Me too.
But I've flown a lot of places in for partly professional reasons, but not always. And so, I think we struggle because our economy is based on the exploitation of fossil fuels, and so we can't. None of us are completely. We've all benefited in a sense from that exploitation. We have to acknowledge that. Yeah. I mean, I have been a lot more self-critical about my travel in recent years. So, certainly in Europe, certainly pre-COVID, I was trying to avoid any flights in Europe, and I found you can increasingly, it's really possible to most places by train, which I found over recent years, and certainly pre-COVID, really enjoyed that way of traveling. COVID is a bit more difficult, but come the vaccine, we hope to return to that. So that's been one thing. I suppose my diet for many years, I've not been an enthusiastic meat eater. I sort of haven't been absolutely. I've never been a very successful vegan, but I respect people who can keep to vegan, vegan choices. But I think certainly thinking about one's diet, trying to minimize the environmental footprint as far as possible. We know now that the kind of healthy diets can also be the low environmental impact diets. So consuming more plant-based foods, for example, certainly a lot, zero or very little red meat, and reducing dairy and so on, all good for the environment. And with the right mix, of course, can be a very healthy choice. So that's certainly something I've been sort of thinking about, and more or less successful, not entirely. Like all of us, we're all flawed, and so we have to struggle as much as we can. In terms of personal transport, I am a cyclist. I do try to cycle and walk in cities. I don't like private cars. For many years, I was a bit of a petrol head, probably in my youth, but now I'm very anti-car. Unfortunately, we had to buy one because of COVID, because we can't use transport anymore, but we're going to get rid of that as soon as the vaccine comes along. So we've got a plug-in at the moment, but it's not ideal. So I think we all have to struggle with this. It's not easy, and that's the whole point, is that we have to struggle with it. It makes us think about it. You can, but now you can buy zero carbon energy for your house. There's lots of providers now, 100% renewable energy. You can even buy biogas until you before you move over to electric heating, which I guess is where we're going, either hydrogen or electric heating in years to come, as a transitional fuel. Maybe biogas you can buy from many suppliers now, some suppliers. So I think we can all pay attention to what we're doing and try to minimize the environmental footprint. But of course, the big struggle is reducing our consumption patterns. We're all used to buying stuff off the internet, and about the circular economy, using stuff, buying secondhand. And that again is a bit of a culture shift, I think, for all of us. So we're all together, and we have to learn again from each other. I'm heartened by the fact that there are more and more businesses that are basing their business model on the kind of circular zero carbon economy, and I think that offers real hope for the future. And I'd like to see many of these businesses and innovations flourishing. I think it's an exciting time actually to be an innovator, to be coming in as as many businesses developing their whole perspective around the zero carbon circular economy.
Thank you for that. And I guess my last question would be, what words of advice do you have at this point for people who are just starting in public health? And I wondered if you could touch on the role of advocacy as well as part of that.
I suppose the first word of advice is never give unsolicited advice.
Well, I did solicit it.
Well, I remember once a very senior professor said to me, well, you know, if you want to succeed, you've got to focus.
Yes.
And I think what he meant was not just focus on your work, but actually focus on a very narrow part of science. And I'm thinking to myself, well, I'm not going to do that. So, you know, I think cautious in giving advice, but if you're asked, you know, one has to lay down some broad principles because everyone, you know, has a different perspective and will come at this slightly different approaches, which is good, you know. And so I think obviously you have to do something that you believe in, that fits with your vision, you want the kind of values you have in your life. I think we have to try and align our values with our scientific principles. And, you know, people have different contributions to make. You know, some it will be generating new knowledge. Others it will be, as you say, around advocacy, which is really important. So making change happen, really important kind of skill. And I think that's particularly so in public health. I think one of the very few good things about COVID is it's kind of transformed the view about public health.
I agree.
People saw public health as a rather kind of boring pedestrian specialty, but actually, of course, it's a really potentially very exciting framing of seeing human endeavor, human health in the bigger context. And I think COVID's opened up people's eyes as to just how important and how vibrant a public health career can be. And because it can span a range of different domains, you know, right the way from clinical medicine through public health, social care, public health, entrepreneurialism, innovation, public health, basic science, public health, environmental sciences, public health. So there's so many different ways you can approach public health. And I think that's really, to my mind, tremendously exciting. So we need to welcome people from all these different approaches because they will enrich this transdisciplinary endeavor of public health. And I think it's a particular pleasure to see a much closer working relationship with the environmental community.
I agree.
The human health community.
Yeah.
I think there's going to be a lot of very rich interchange. So it is an exciting time. We need to open the doors widely, be welcoming to people. People will have all sorts of careers. I think it is important to link the local with the global.
Yeah.
If you're just doing work at the global level, you can become quite pessimistic about the potential for change. If you work at the local level, you can feel, well, the change that I'm making is not sufficient to change the world. But if you can see the dynamic, the dialectic between the local and the global, and the fact that all global is local, and in a sense, vice versa, you know, this is inevitable
I agree.
dialogue between them. So I think that's really important to frame your work within that broader context, to sustain yourselves through the kind of work you do locally in your day-to-day life, but have in mind that bigger goal that many of us are trying to work towards. So it is, of course, a difficult time, but you know, in every difficult time, there's real opportunity.
Yeah.
We are now seeing, I mean, we're seeing in the States, for example, the last few weeks, it's been exceptionally difficult, but you know, there are also green shoots of change, and we're seeing an incoming political team, which I think will really put climate change in particular at the center of, or at least there'll be a big role to play for climate change mitigation. So I think there's a really double down on this vision of how we can create a low carbon, more sustainable economy, or zero carbon, more sustainable economy that will also improve health. And there's lots of ways we can do that through decarbonizing the energy supply, you know, less air pollution, decarbonizing transport, more physical activity, less air pollution, healthier, sustainable diets, the kind of work you've been doing on blue and green space, better mental and physical health.
Thank you.
So by the way, of course, protecting blue and green space also helps to lock in carbon. So it's also, in a sense, a climate mitigation strategy if we can protect our green and blue spaces. So there's so much to play for, and it's a very, very exciting time. And I think people that are choosing this career have made absolutely the right choice.
I agree.
Constrained by a narrow view of public health. Think of it broadly, and it can be what you want to make of it.
I agree completely. Thank you. That was a wonderful discussion. And I think, well, we're very lucky to have you in our lives. So GJ, you are handling the questions. I hand it over to you. And I believe you want people to put the questions in the chat.
Yes, please. We've had some really fantastic questions come in. Please keep sending them. So our first question is, what would a healthy humanity or a healthy and flourishing human civilization look like? And what is a planetary health vision for the purpose and role of human civilization?
Well, I think what would a healthy society and that vision look like? I think it would be a world population in which everyone had the opportunity to fulfill their potential and to at least potentially to achieve the kind of life expectancy, the maximum life expectancy, say the life expectancy experience in countries like Japan, for example, in an equitable fashion. So that would in a sense be but within planetary boundaries. So the important point here is that how we achieve that improved life expectancy, healthy life expectancy really matters. If we achieve it by undermining the natural systems, that will mean that that future generations and even other people alive today cannot enjoy the same benefits as we are enjoying, then that is not planetary health. That is the inequitable exploitation of our shared environment. So it does need to put at its heart supporting people to achieve their potential in an equitable fashion. I think it means also raising our focus from a sole obsession with economic growth to how can we promote a flourishing human population within planetary boundaries. So it also means influencing the political discourse. And I think integrating, as I say, the health and environmental agendas. So that in a nutshell, I think is what we need to be doing.
Thanks. So we have another question, which is, what can we do, if anything, about vested interest groups lobbying for change that is against planetary and public health? And some examples include the agricultural industry being a major driver for environmental destruction, and how we can, as health professionals, ensure that advice to reduce meat and dairy consumption for the benefits of the planet and for patients aren't obstructed by large vested unions.
Thank you. That's absolutely crucial question, of course. And one of the things that struck me when I was chairing the Planetary Health Commission and subsequently is that so much of our business models of conventional industry depend on not paying the full economic cost of your activities. So the fossil fuel industries, for example, or when we go to fill up our car or whatever, you know, we don't pay the full economic cost of that fuel. We don't pay the cost of the air pollution, the damage to climate today and tomorrow. That's absorbed in a sense by nature, and eventually will come back in a sense to bite us as a civilization. So one of the things, and economists have been telling us for years, that we need to internalize those so-called externalities, because we're actually subsidizing, in a sense, our own destruction, which is an extraordinary thing to do, really, when you think about it. So we don't pay the full economic cost of fossil fuel burning and many other of our economic activities. So we need to find a way of internalizing those costs, and that can be done in the case of climate change through adequate carbon pricing, for example, carbon taxes in some cases. We've known that for years, and yet it's been slow to get off the ground. And the reason for that is, of course, very powerful vested interests. So what they do usually is to say, well, we can't pay the full economic cost because if we have to do that, you'll destroy our industry, and that will mean lots of jobless people. And that's often a very powerful argument for politicians, because politicians are judged by what they deliver in a year, couple of years at the most, maybe 5 if they're lucky. What we're talking about is a future for humanity, which is a different timescale altogether. So whilst I don't want to make excuses for politicians, I do have some sort of understanding that they are on a different timescale from the rest of us, and that's tough. which is why we've been emphasizing the importance of health co-benefits. So what we've been saying is that, yeah, okay, there will be some winners and losers, but there are big benefits from going towards a zero carbon economy. First of all, if you invest in fossil fuel industries, you get far fewer jobs for your buck than you do if you invest in renewable energy, for example. You get almost 3 times as many jobs from renewable energy than you would in the fossil fuel industry per $1 million or whatever invested. So you can create more jobs if you plan it properly. But what we have seen, unfortunately, is that many populations have been left behind and they've become victims of populism and they've become disadvantaged. I mean, my early experience working with Julian Tudor Hart, we worked in a coal mining community, and those people, the coal miners, had provided energy for this country, for the Industrial Revolution, for decades and decades and decades. When there was no longer any need for coal mines, they were just abandoned. And I found that to be outrageous. And I thought that it was a lesson also for the Anthropocene, that we need to think in advance about how we can ensure that those people who have based their economic model on activities no longer sustainable, that we think about how to address their needs, particularly the most disadvantaged ones, so that they then do have an opportunity and a future in the Anthropocene. In terms of food systems, yeah, you're right. I mean, of course, there are massive lobbies in food systems, which are also, campaigning about the need for meat and animal products. We saw that with the Eat Lancet Commission, when they published their report last year, but in 2019. Within a few weeks, there was a massive social media campaign to try and undermine the findings of that commission. That was being pushed by the meat industry. So we have to anticipate that these powerful industries will try to, of course, defend their own corner. Where possible, we need to work with them. And some of them do want to shift. But they're also, industry is not a monolith. So we also see a number of other innovative companies and concerns, particularly in the food system, who are looking at entirely different models. So innovative foods, which are much lower environmental impact, for example, the Impossible Burgers of this world. Now, some of those are not nutritionally ideal. We have to be a bit skeptical as well. Some of them are ultra processed, they're not perfect, but the point is that there are steps in the right direction. So we need to be critical, but constructively critical about these new developments. So let's think about what innovative business models there are, which can combine improving human health with sustaining the environment. And I think there are an increasing number in the energy sector, in the food sector. We're seeing housing, built environment models now, energy retrofitting, passive houses, which will generate more energy than they actually consume. So there's a lot of products coming on stream. The challenge is to reform the economic system so that there's a business case for investing in these products. And that's where we have to get political change. And that means working with policymakers, trying to influence policymakers and making the case that there are near-term benefits to moving towards a more sustainable economy.
So Laura, I know that a lot of your research at the moment deals with supporting small and medium enterprises to be more inclusive, right? With a view from that public health perspective. Do you have any thoughts on that?
To me, it goes back to something that Andy said, that one of the beauties of, I think, the direction that public health is going is that it's diversifying, it's becoming transdisciplinary, whatever that actually means, and that it's involving increasingly different types of people. And I think there is research, for example, that shows that even within a single workplace, the more diverse the background of the workers, and diversity can be defined in lots of different ways, as we know, as public health people, the more creative it is. And so I think working with small and medium businesses, particularly small businesses right now, is very challenging. They are at the cliff face because of the pandemic and what's been happening with lockdowns. At the same time, we're seeing businesses, because they are small, they are fleet of foot, they can change, they can be innovative along the lines that Andy said. So I think as a society, we need to support businesses to embrace diverse employees. So not just in terms of people of color or different national backgrounds, but also people who are disabled or older workers, and I'll put my hand up for that one, and people with long-term illnesses. How do we keep those people involved in an ongoing fashion over their life courses? And I guess the last thing I would go back to is something that Andy was saying in terms of how he would perceive a good society going forward. It's also about people's quality of life combined with a respect for the environment. I mean, to me, those are the two sort of factors of values that we need as a society if we're going to succeed going forward.
So we have another really interesting question about the potential trade-offs involved with prolonging life expectancy. So one question is that the success of modern medicine has led to increased life expectancy. So we need to improve life expectancy in an equitable fashion, but of course, simply living longer extends the lifetime carbon footprint. When should we say that enough is enough and focus on ensuring quality, perhaps, rather than quantity of life with potential benefits for the environment?
Yeah, that's a really important ethical issue, and I wouldn't presume to have all the answers for it. I would just slightly question whether all the increase in life expectancy has been due to modern medicine. I do think that actually the social determinants of health have played a really important role. Of course, biomedicine is important. Many of us have benefited from it, but it's not the only factor. So the social determinants, which have been important, and to some extent, changes in the environment as well, although they haven't gone far enough. But many countries have seen a reduction in, say, air pollution levels and so on, and improvements obviously in diet. So it's a combination of factors. When is enough? I think an individual can't answer that. It's a societal debate. What I do think we need to focus on, as the questioner has suggested, is quality of life. Also, I think palliative care is a really important part of healthcare and living and of public health. And another hat that I wore for some time was chairing the research committee for Marie Curie about end of life care. And as a family doctor, of course, I was very much aware that sometimes the end of life experience was not a good experience, either for those who are dying, but also for their loved ones. And so ensuring that people have a humane end of life in which they have the potential to choose the kind of end of life that they want, and we have those frank conversations where we can, is really really important. So I think part of that is about perhaps demystifying the whole process of the end of life. We're all going to come to the end of our lives, and we need to we're not going to probably welcome that, but we need to approach at least with clear eyes. And also we need to foster a debate within society about what is appropriate. I always found it curious, that we raise money, we collect money for palliative care, and yet, our National Health Service is meant to provide care from cradle to grave. So why is it that palliative care is actually not part of, doesn't seem to be part of that whole NHS? And it's I think, important question. So I think we need to have the sort of clear-sightedness and courage to face that and to have those difficult discussions. It's not for us to say to individuals, this is your time to go or whatever. Everyone will make up their own minds as to how they should and wish to spend their last moments and last months. We need to make that as humane as possible. The issue of the balance with carbon is a difficult one, but it's just the length of people's lives. It's also the way in which they live. I mean, we know that the inequalities in carbon footprint are absolutely enormous. There's a great book, I don't have it in front of me now, but it's all about carbon inequalities. And it shows you how some super rich people have carbon footprints which might be thousands of greater than the average in society, because they're flying everywhere. They drop of a hat, they'll fly off to New York or whatever. So we have to deal with the inequalities in carbon footprint. And you won't, I don't think, be able to have this discussion unless people feel that we're all contributing, perhaps not exactly equally, but at least there's much greater equality. And why you've got such disproportionate carbon footprints between rich and poor. I think it's a difficult discussion to have. So let's have a discussion about equity, what the carbon and other footprints should be in terms of equity of those. It isn't just a question of length of life, it's also how you spend that life. Quite a short life, but a very high carbon life. So I think it's a question of thinking about how we can enjoy, hopefully, a long and healthy life, but as lower environmental footprint as possible.
So we've received a really wide range of really interesting questions, and unfortunately we won't get to all of them. But for the last question, I just want to circle back to your point about political timeframes and long-term action. And I think it's reflected in a question that we've received, which says that many of the adaptation and mitigation actions that will benefit climate and public health are long timeframe projects. What are the kinds of political mechanisms that are available to us to ensure that long-term, long timeframe investment for the kinds of actions that need doing?
Well, the political frameworks for that is actually rather limited because it's very much dependent on elected politicians. And elected politicians have their 5-year time frame. When we're lucky, we can find policies in which there's a political consensus. Now, in the US at the moment, that political consensus is broken down. But I think in the UK, we can say that at least in terms of rhetoric, at least in terms of carbon rhetoric, if I can call it that, there's a reasonable political consensus. I mean, the extreme climate change deniers and the naysayers have kind of don't have much political traction here at the moment, thank goodness. In the States, that's rather different, but that may change over coming years. So we need to try to establish a political consensus across at least the mainstream of politics. You won't convert everyone. There's no point in trying to convert the 5% of complete deniers as well. That's really important, I think, to try to achieve that political consensus about what we need to do, even if there's a difference in view about how we need to do it. So, you know, it may be that the Republican Party could sign up to say, yes, we need climate change mitigation, but it's got to be done through very strict market mechanisms. Well, okay, that's your belief, that's fine. So, you know, I think that would be legitimate. But if we can develop some kind of shared goal, then that I think is really important. But I do think coming back to maximizing the near-term benefits, or at least communicating the near-term benefits, is really important. And that's why we spent quite a lot of time in trying to quantify the near-term benefits, for example, of dietary change, of reductions in air pollution, because those benefits do come through quite quickly, you know, within years, in terms of not decades, which is climate change mitigation. You know, the reductions in climate, you know, temperature, or the stabilization of temperature obviously takes time. But the near-term benefits of mitigation through reductions in air pollution, improved diets, improved physical activity, better mental health, they can come through quite quickly. You know, within a few years, perhaps almost months in some cases. So I think we need to emphasize those, and we need to quantify them, and also to create synergies between the public health agenda, which is good for our health, for the health of ourselves and our loved ones, but also good for the planet. So finding messages that are kind of synergistic, I think is really important. And going for role models, you know, popular role models of maybe popular figures in culture that are changing their lifestyle. You know, Lewis Hamilton becoming a vegan, you know, that's probably a really important signal to a lot of people. I mean, okay, he's still driving fossil fuel powered cars, but he's a vegan, and you know, that's an important signal. So I like, you know, I think, you know, popular culture can play a very important role, and you know, opinion leaders will influence people. So we should capitalize on a whole range of different mechanisms, I think. It's not a one size fits all.
And I would just add, and maybe this is very idealistic, but going back to your point, Andy, about working locally and thinking globally, which was a mantra from my youth. I think also working in your local community, providing exemplars of where things can work at an individual or community level, and to the extent it's possible, trying to network with other communities around the world, not just within the UK or the US. And also, I think another thing that you mentioned, Andy, is learning lessons from other countries, other societies, history that allow us to show positive examples and live in a positive way.
Yeah, if I could just chip in there, Laura, because it reminds me to say that our latest initiative is something called the Pathfinder Initiative. So the Pathfinder Initiative is funded largely by the Wellcome Trust with some support from the Oak Foundation. But what it aims to do is to capture lessons from the implementation of decarbonisation strategies. So for years, we've been kind of modelling what we'd like to see. But what's really crucial is what's actually happening. What happens when people try to put into practice strategies, policies, technologies that decarbonize the economy, reduce the environmental footprint? What successes and failures can we document? How have they achieved change where they've been able to do that? And what benefits and possibly disbenefits, what trade-offs are there have been documented? I think that's really important. So what we're doing now, and we're about to issue a call for evidence on that, is trying to capture the lessons from kind of implementation, examples of implementation, and trying to share those widely. So there may be share them, geographically, in terms of different approaches. There might be at the city level, there might be at the national level, there might be at the very, very local level, even at the level of things like transition towns and so on. So there's all sorts of, I think, opportunities for us to share good practice and to learn from each other's successes and failures. We hope failures should be, honest failures should also be celebrated, because where people have really tried to do something that hasn't worked, we all need to learn from that. We need to capitalize on those lessons. So that's what we're trying to do at the moment. And it's a commission which will publish in the Lancet later, hopefully next year as well, chaired by Helen Clark, who's a former head of UNDP and PM of New Zealand, and Joy Famafi, who's former Vice President of the World Bank, Minister from Botswana, and myself. And we're hoping to capture these lessons together with our wonderful colleagues on the team.
That's great.
So I know that Cecilia is about to launch a brief poll just before we wrap up. But in conclusion, I just wanted to thank you both most sincerely for your help in launching the Exeter MPH. Sir Andy, it was great to have you. And Laura, thank you so much for joining us and helping us to host this conversation. I know I've certainly learned a lot, and it's been a privilege to hear from you both. And thank you as well to all the people who contributed very interesting questions. I'm sorry we weren't able to get to all of them, but thank you all very much for your participation, and we hope to hear from you soon.
Thank you very much. Thank you, Andy.
Thank you very much.